Welcome back to another informative lab video. This one is about thyroid function testing. In this video we will discuss the importance of thyroid function tests and provide reference ranges for the thyroid stimulating hormone, TSH, T4, T3, and free thyroxine index, FTI. But before we begin, please note that the information provided in this video is for educational purposes only, and should not be considered as medical advice. Always consult with a healthcare professional for personalized guidance. Thyroid function tests are commonly ordered by doctors to evaluate the function of the thyroid gland. The thyroid is a butterfly-shaped gland in the front of the neck, underneath the voice box. The thyroid gland secretes three hormones: thyroxine, also known as T4, triiodothyronine, also known as T3, and calcitonin. However, calcitonin is not regularly part of a thyroid panel. T3 and T4 play a crucial role in regulating metabolism, growth, and development, so they affect almost every organ in the human body. When the thyroid gland is not functioning properly, this dysfunction can lead to various health issues. When thyroid levels are too high, this is called hyperthyroidism. Graves' disease is the most common cause of hyperthyroidism. When thyroid levels are too low, this is called hypothyroidism. Hashimoto's disease is the most common cause of hypothyroidism. Now, one of the most commonly measured thyroid hormones is the thyroid stimulating hormone, or TSH. The TSH is a screening test to inform the healthcare provider of a thyroid gland abnormality. TSH is produced by the pituitary gland, and the TSH stimulates the thyroid gland to produce thyroid hormones, namely T3 and T4. The reference range for TSH is typically between 0.4 and 4.0 milli-international units per liter, MIUL. So, when an elevated TSH is seen on a lab report, this elevation may indicate that the thyroid gland is not making enough thyroid hormones. As a biological response, the pituitary is sending an increased amount of TSH to the thyroid gland so that the thyroid gland will make more thyroid hormones. As well, if a TSH result is low, then the thyroid gland is making too much thyroid hormone. In turn, the pituitary gland stops secreting as much TSH, so that the thyroid gland will decrease production of thyroid hormones. The next important thyroid hormone is thyroxine, or T4. After the T4 is produced by the thyroid gland, it is an inactive hormone in the bloodstream. When the body wants to use T4, the body changes T4 into the active form of thyroid hormone, triiodothyronine, T3. The reference range for T4 is usually between 4.5 and 11.2 micrograms per deciliter, mg/dl. Decreased T4 tells the doctor that hypothyroidism may be occurring. As well, increased T4 tells the doctor that hyperthyroidism may be occurring. Next, let's look at triiodothyronine, or T3. T3 is the active form of thyroid hormone that affects various body functions. There are two forms of T3, free T3 and bound T3. The free form of T3 enters the body's tissues where T3 is needed. Bound T3 attaches to different proteins. Attaching to proteins prevents T3 from entering the body's tissues. The reference range for T3 is typically between 80 and 200 nanograms per deciliter, (ng/dl). The free thyroxine index, or FTI, is a calculated value that provides an estimate of the amount of free thyroxine, T4, in the blood. The reference range for the FTI is generally between 1.2 and 4.9. Thyroid function tests are ordered for various reasons. A doctor may order these tests if a patient is experiencing symptoms such as fatigue, weight changes, hair loss, or mood swings. Thyroid function tests can also help diagnose thyroid disorders such as hypothyroidism or hyperthyroidism. Generally, a physician will order a TSH alone. If the TSH is shown to be increased or decreased, then the doctor may order the T3, T4, and FTI. Depending upon the panel's results, the doctor may also request a free T3, free T4, thyroglobulin antibodies, thyroid peroxidase antibodies, also known as microsomal antibodies, and thyroid-stimulating immunoglobulin, as well as thyroid imaging such as a CT or an ultrasound. These lab tests that I just mentioned help point the doctor towards a diagnosis and ultimately, the right treatment. A plug for the Doctor of Clinical Laboratory Science here. As a leader of a thyroid diagnostic management team, the DCLS can interpret and suggest the appropriate laboratory testing to arrive at a more efficient diagnosis, thereby a more efficient treatment, and potentially, less cost to the patient and insurance company. In conclusion, thyroid function tests are essential for evaluating the function of the thyroid gland. The reference ranges for TSH, T4, T3, and FTI provide valuable information for healthcare professionals in diagnosing and managing treatment of one's thyroid disorders. Remember to always consult with a healthcare professional for personalized medical advice. We've covered a lot of information in a short time. Feel free to go back, re-listen to parts of the video. Let us know if there are other thyroid tests you would like to learn about. And as always, we thank you for taking some time to watch our video. We're striving to help others learn about laboratory testing by helping people become advocates of their health. Let us know in the comments if there are other thyroid tests you would like to learn about. We're striving to help others learn about laboratory testing by helping people become advocates of their health. Thank you once again for spending your time with us to understand the importance of thyroid function testing. We hope you found this information valuable and helpful. If so, we would appreciate it if you could hit the like button. This helps us out a lot and gives us a good indication that you're finding our content useful. This also tells the YouTube algorithm that this video should go out to more people, and they may want to know this information too. Moreover, if you want to stay updated with more health-related content like this, don't hesitate to hit the subscribe button. We regularly post videos covering a diverse range of laboratory topics, and subscribing ensures you don't miss out on any of them. So, join the lab community today and let's continue our journey towards better understanding of lab results, better health, and improved patient advocacy. Remember, your health is your most precious asset. Stay informed, stay healthy, and we'll see you in the next video.